This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Coming up today, we'll be talking about the best of Morgantown here on the program. If you have thoughts, questions, you're welcome. Text the show at 304-TALK-304 this morning. I'd like to welcome our guest into the program, Dr. Arielle Placke. Good morning, Doc. Oh, let me hit the button. Let me try that again. Dr. Arielle Placke, good morning. Doctor, can you hear me?
Can you hear me?
Yes, doctor.
Okay. Good morning.
Dr. Arielle Placke, good morning. How are you?
I'm good. How are you?
I'm great now that we got the phone situation
Yeah.
worked out there. I'm glad you can hear me. And also joining us this morning is Brianna Vikartosky. Did I get that right?
Yes, that's right. Good morning.
Oh, good. I was worried about that as well. Good morning. They are with Mon Health Primary Care in Morgantown. Good morning, guys. I'm glad you could take some time with us here on a busy Monday morning. We'll get into the subject, Best of Morgantown, in just a moment. But first, I always make our guests talk about themselves for at least a minute or two. Dr. Placke, we'll start with you. Tell us about yourself, your background, education, where you're from, how you ended up at Mon Health. Give us the short biography, if you will.
Yeah, I'm from Hanover, Pennsylvania. That's where I grew up, and I went to Penn State for undergrad, and then LECOM at Seton Hill, which is Lake Erie College of Osteopathic Medicine, and that's in Greensburg, PA. And then I did my training at Conemaugh Memorial Medical Center in Johnstown, PA. And then I started at Mon Health almost 3 years ago. Came to Mon Health because my husband's from West Virginia, and he actually is a general surgeon at Mon, and he, when he was in medical school, he rotated through Mon and just loved it, and so we've been here for 3 years now, and yeah, it's been going great.
Hear that story a lot, Dr. Placke. You get here and you go, oh, well, kind of like it, and before you know it, the time flies by pretty quickly, doesn't it?
Yep.
And also joining us, I mentioned Brianna Vikartosky. And Brianna, what's your background?
So I'm from Connellsville, Pennsylvania, not too far across the border, and I did my training at West Virginia Wesleyan College for my RN, and then went back there for my nurse practitioner degree also. And I did a lot of my rotations in Morgantown at WVU for nursing and at Mon General. So after I graduated nurse practitioner school, Mon was hiring a primary care nurse practitioner. I interviewed and got the job, and I'm so glad I did. My husband actually works for Mon also with Dr. Placke's husband, so we have that in common. But I'll be here for 5 years this March. So
wow, yeah, you get drawn in, and not that I'll spare you my story, but I thought I would be here a couple of years, and that was going on 13 years ago. 14 years ago now. So I understand. Totally. So I will let you two, who wants to deliver the big news? Mon Health Primary Care. What's the exciting news to share?
I'll tell you.
Okay.
So Mon Primary Care, we were nominated for Best of Morgantown from Morgantown Magazine for 2023 as Best Primary Care Clinic. So we're pretty excited about that. So
what... that's voted on, right? I mean, thousands of people will get an opportunity to weigh in on this competition, don't they?
Yeah, from what they told us, 161,000 ballots were cast for people to select their favorite local businesses. So it was a lot of people. I don't know how many voted for us specifically, but...
Well, it does say something, Dr. Placke, that if people were unsatisfied, they would certainly let you know it, obviously. So I think it does certainly say something about the service and the quality of service and the relationships that are being built between care providers and patients there at Mon Health Primary Care.
Yeah.
And,
Yeah.
and Brianna, what's your take on it? What's your reaction to that vote and that recognition?
I was super excited to find out that we won. I was surprised that day when our manager came to tell us, but we work so hard, from the girls up front checking people in to the girls that get the patients ready to see the providers and our providers, that I really think that it shows that we put a lot of effort into taking quality care of our patients and really trying our best every day.
And do you think, though, that for this sort of a competition where people are voting, something has to stick out, not just, I don't want to say your run-of-the-mill care or service. Something has to stick out, and usually that means going the extra mile. Do you see that around the office, Brianna?
Yeah, I definitely see that. Whenever one of our patients calls in, or even it's a new patient that wants to establish care with us and they need something more urgently, we work really hard to get that person seen or find out what they need. If that's staying later at the office or even coming in early to see someone. I think, and we always try to communicate really well with our patients. If I say that I'm going to call you about something, I try to make sure that I do that. Or even if I don't know the answer to something, I always tell patients that I will try and find them, out the answer for their best care.
And let's talk a little bit more about Mon Health Primary Care. Dr. Placke, what services are available in Morgantown through Mon Health Primary Care?
Yeah, we have kind of your full range of primary care things. So we treat a variety of illnesses and conditions, and we have health screenings, physicals, and then, primary wellness and preventative health care. But we also do see acute visits for established patients. We have most of your basic vaccines, specifically for adults, but some for the younger ones. We do basic office procedures, and now we're doing blood work for established patients that come in for their visits. If we need to draw labs, we can do them in the office now. So we have lots of different things that we do.
In addition to, obviously, you and Brianna, are there other practitioners there at the clinic?
Yes. Dr. Hess, who he wanted to do the call, but unfortunately his schedule didn't work out, and Dr. Petla as well. She's actually a little bit newer. She started in October. But, yeah, there's the four of us.
We're talking about Mon Health Primary Care this morning on Mon Health Talk. Mon Health Primary Care voted the Morgantown Magazine's 2023 Best of Morgantown for Best Primary Care Clinic. Our guests this morning, Dr. Arielle Placke and Brianna Vikartosky, and we'll continue our conversation right after this quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Dr. Arielle Placke and Brianna Vikartosky, NPC. They're with Mon Health Primary Care, voted Morgantown Magazine's 2023 Best of Morgantown for Primary Care Clinic. And Dr. Placke, why is it important to have that primary care physician?
Well, it's really important to keep up with preventative care things, and especially with, your usual physician that knows your chronic conditions and, what you're like when you're normal, because we can tell pretty quickly when someone's not at their baseline and we need to intervene, if they're sick or something. So it's really important to be seeing someone regularly, at least, once a year, so that you can keep it, up to date with everything that you should be.
And Brianna, why is it essential to have that routine care? Because you really hear this all the time. I'm healthy. I'm in good shape. I don't need to go see the doctor this year or next year or any year for that matter. But why is it important, even if you are healthy and in good shape and you're doing all the right things, to go get that annual checkup?
Yeah, we do hear that all the time. People call and say, oh, I was just there, or, and we say we really like to see everyone once a year, especially people who are healthy and people who have chronic conditions such as hypertension, diabetes, chronic kidney disease, we like to see those people every 6 months for labs or every 3 months to keep a close eye on them. But it's important to be seen even if you're healthy. That way we build a rapport with the patients, that, like Dr. Placke said, we can tell if something's changed. But for our healthy people, we still want to order your preventative screenings. We want to order, ladies' mammograms, keep up with their cervical cancer screenings, colonoscopies for everybody. That way, if there is something abnormal, we catch it early, and then we can intervene sooner rather than later.
And Dr. Placke, what would you say to the person who would say, okay, yeah, but if I'm feeling bad, if I got an issue, I'll go to the urgent care clinic or I'll go to the ER and get a prescription or get checked out there. What would you say to that person?
Well, it depends on the problem, obviously, but for majority of things, we like to see them in our office so that I know what's going on, with my patients. Of course, there are times that, we just don't have an opening, so they do have to go to urgent care on a weekend or something. But ideally, if you could see the same person or someone who knows you more chronically, then we have a better idea of, how sick you are, and maybe could save you that trip to the ER or, prevent you from being admitted to the hospital, because we know how you normally do.
Yeah, you have that overall picture and possibly years of a relationship built over years. We go,
right.
Yeah, you can look at it from a much larger viewpoint than a physician, who's seeing the patient for the first time and only maybe treating those particular symptoms or that particular ailment at the time, right?
Right. We don't want to put people with hypertension on certain medicines over the counter for, cold and flu, because that can make their blood pressure worse. But maybe if they go to an urgent care, they might not, realize that they have high blood pressure, so they would recommend things like that. So, similar for any other problem, there are certain medications you don't want to do or might be better for a particular problem.
Brianna, how often do you hear patients who do eventually come in for that appointment go, oh, that's not so bad? They get all worked up in their minds, worried about coming in for that checkup, coming in for that annual appointment. And once it's all done, they go, oh, that wasn't so bad.
Yeah, every day. And I try to tell people, you shouldn't be afraid to come in and be seen by one of us, because we're super nice and we just want to do the best for you, even if that requires that person to get some blood work or to get, their screening done. And then once they do it, they feel so much better and relieved that they completed that visit. So,
yeah. Do you often run into people who will tell you, well, if I don't go to the doctor, they can't find anything wrong with me?
Yes. And we do hospital discharge follow-ups here. So whenever the patient's admitted to the hospital, they like to be seen within 7 to 14 days after discharge. And a lot of those patients are people who have never been seen by a primary care provider. So our goal with them is to try to get them to not go back to the hospital and then establish care with us, for the rest of their needs.
Dr. Placke, do you have same-day appointments? Will you see same-day patients?
Yeah. Again, it depends on our schedule and what sort of openings there are, but we will, if someone calls in that they're not feeling well, we try to get them in same day or the next day, depending, and say, you can't see me exactly. Sometimes Brianna has an opening, or one of our other providers might have an opening, and then, but we'll get you in as quickly as we can if we're able to.
Brianna, what are some examples of things you will see on a same-day basis? Yeah,
so people who call in with cough, cold symptoms, we'll see them, see if they have a sinus infection, if they have the flu, urinary tract infections. We can do the urine dips in the office here and go ahead and, get that patient possibly on antibiotics that same day. People with an injury or, back pain, something like that, if they had a fall, we can examine them and see if they would need further evaluation with x-rays or to go to the hospital if needed.
Talking to Dr. Arielle Placke and Brianna Vikartosky this morning, MPC, Mon Health Primary Care, Morgantown Magazine's 2023 Best of Morgantown for Primary Care Clinic. Dr. Placke, where are you located?
So we're close to the Hobby Lobby in Morgantown, so it's 6000 Memorial Church Drive, and we're on the first floor, which is Suite A.
That is a good landmark. I know exactly where you are now that you mentioned near
There's only one.
Yeah, that's right. Great landmark right there. Are you accepting new patients, or if someone has not had a primary care physician for whatever reason for a long time, can they give you a call? How do they go about that?
Yes. So our number is 304-598-7313, and you can call and schedule with us. They'll connect you to the pre-access center, and those girls are good at getting people scheduled with you for a new patient visit. And you can also go to monhealth.com/primary care, and there's tons of information. You can see all of our pictures. It's probably more information than you need, honestly.
We got about a minute here, Dr. Placke. What would a new patient visit consist of? A first-time patient visit consist of?
Yeah, it depends on how many chronic medical problems you have. So for the standard young, healthy new person, it could just be, I want to find out your medical like any medical history that you have, your social history, any family history that's contributory, and then if it's a pretty standard, then I will do usually a wellness visit with that. So just go over their preventative health screenings, vaccines, and if they need any blood work, just for general medical care. And then if it's a little bit more of a complex patient, somebody who's seen a bunch of physicians in the past or has a lot of specialists or other things, it could be just going over all of that and getting to know them, and then they have to come back maybe for the preventative health wellness visit after that, just to make sure that we don't miss anything and we can give each item the attention it needs.
Brianna, what do you want folks to take away from our conversation today?
I want people to know that it's important to see a primary care provider at least once a year to get established and to have your preventative screenings ordered, and not to be afraid to come to the doctor's appointment. We're here to help, and we'll do our best. So
you can get more information. Go to monhealth.com/primary care. Dr. Arielle Placke and Brianna Vikartosky, thanks so much for taking some time here on a Monday morning. I appreciate it.
Thanks for having us.
Thank you.
Absolutely.